Diabetes mellitus or DM. Diabetes mellitus is when a patient or a person has sustained hyperglycemia or high sugar levels, so serum glucose above the normal, that is not a side effect of something else or a medication. The classic symptoms of diabetes mellitus. So we have the 3 P's. Polyphagia, which is excessive eating, polyuria, which is excessive urination, and polydipsia, which is excessive thirst. In addition, other signs and symptoms include dehydration, weight loss, glucosuria or glucose in the urine or sugar in the urine, and sometimes fatigue. So type 1 diabetes mellitus, it's basically when the body is unable to produce insulin. So this is type 1 diabetes mellitus. So the cause is usually autoimmune, sometimes hereditary, and sometimes it can be triggered by a viral illness. So in this case, the pancreas does not produce insulin. So this requires insulin replacement. This can also lead to diabetic ketoacidosis when the blood sugars are not under control, especially sometimes in the case of an acute illness. A diabetic patient with type 1 diabetes can develop DKA or diabetic ketoacidosis. Type 2 diabetes mellitus or type 2 diabetes is often because of the inability to produce adequate or sufficient amount of insulin. So as you can see, the difference here is that the body is still able to produce insulin in comparison to type 1. In addition, sometimes the body becomes insulin resistant. So what does it mean? Well, the body can still produce enough insulin, right? The amount is correct, but the body is not responding to the insulin levels. Now, type 2 diabetes can be caused by heredity, so sometimes it runs in the family, sometimes obesity, which is actually the most common reason for developing diabetes type 2 in this community. Another reason can be pancreatitis. Here, the pancreas produces some insulin and sometimes not enough to control the glucose levels. And so over time, this may eventually require insulin. Although in type 2 diabetes mellitus, DKA can still happen, this is not as likely compared to diabetes type 1. So what is diabetes ketoacidosis or DKA anyway? Well, DKA, this happens because there's not enough insulin to control the glucose level, therefore leading to hyperglycemia or high blood sugar levels. So in this case, the body is unable to use glucose for energy, and so the body will start going for a different source of energy. And so in this case, your body will use fat as a source of energy, causing lipolysis. So in lipolysis, or the breakdown of fat, the byproduct are ketones, and then ketones can lead to acidosis. And so think about this. Have you heard of the keto diet? So keto diet is basically when somebody purposely eats high-fat food instead of eating carbohydrates or protein. So when you do that, you go to ketosis, because when you are using fat as a source of energy, the byproduct is ketones. So this is basically very similar. When a patient is diabetic, this can lead to diabetic ketoacidosis. So acidosis, this can cause severe dehydration and electrolyte imbalance, especially your potassium. And so what do they look like? Most of the time, the patient looks like this. Their heart rate is up, their blood pressure is low, and when you check their ABG or arterial blood gas, it will show that they are acidotic, so the pH level of their blood is really low and their blood sugar is really high, usually greater than 240, 250. Their potassium level is also really high, and they're constantly going to the bathroom to urinate. So there's a more extensive polyuria. So in that case, they usually end up in a hospital, and in the hospital setting, we usually need to treat them with fluids, insulin, and electrolyte replacement. This is what DKA looks like. So hyperglycemia or high blood sugar, usually the range is above 100. Your normal range is commonly 70 to 100. So hyperglycemia is usually when the blood sugar level is above 100. So again, symptoms can include the 3 P's, polyuria, polydipsia, and polyphagia. Sometimes it can include blurred vision, drowsiness, tingling pain, or numbness to hands and feet. So if you really think about it, glucose is actually very toxic to your nerves or nervous system. Sometimes with the increased blood sugar, there's a slow or improper healing of cuts and bruises. Hypoglycemia, on the other hand, is usually blood sugar that is lower than normal, so usually it's less than 70. This is often more dangerous than hyperglycemia. So symptoms can include shakiness, weakness, fatigue, hunger, sweating, nervousness, confusion, lethargy, or coma. So some early signs are the shakiness, fatigue, and confusion. And later stage, you don't want to go all the way to the later stage. The later stage, you will see lethargy and coma. So symptoms in children sometimes are going to be different, especially if they're unable to tell you what's going on. So for parents, you may see the irritability and lethargy more than anything else. When this happens, this requires immediate treatment. So if a patient is at home and they develop hypoglycemia, the most common treatments, and it requires immediate treatment, right? The most common ones that they will use is cranberry juice followed by a complex carbohydrate and protein. And sometimes for children especially, we can use cake mate. And so this generally takes about 20 minutes to feel the effect. Just remember though, if we don't see improvement in 5 minutes, we should not overtreat. Because again, we don't want the opposite, the blood sugar bouncing really high. When we're giving PO or by mouth interventions, we need to ensure that the patient is conscious. And so if they are unconscious, this is a medical emergency. So if they're in the home setting, it may be necessary to call 911. And in the hospital setting, definitely rapid response needs to be called. The doctor needs to be called. There needs to be an IV access so that they can administer dextrose.